clinical psychology team is made up of clinical psychologists, psychotherapists and counsellors, and they're all trained and experienced mental health professionals. The department is based here at Salisbury District Hospital, and we help support people who are struggling with psychological difficulties linked to their cancer diagnosis and or treatment. We understand that having cancer can have a far-reaching impact on the patient and their support network. So as well as working therapeutically with the patient, we also see family members and carers that are experiencing psychological difficulties linked to their loved one's cancer diagnosis. We also work really closely with other professionals in the cancer teams to help ensure that patients are supported throughout their cancer care.
We understand that a diagnosis of cancer can have a really big impact on psychological well-being and take time to process sometimes. So what we aim to do in psychology is offer support to people to process some of those emotional and psychological challenges they're experiencing and help them cope with and adjust to those, as well as helping them build the best quality of life possible. We do this by offering a whole range of evidence-based psychological interventions that are tailored to meet each person's individual needs. And the aim of that really is to focus on what the patient needs and to help them process and get a really full understanding of their difficulties so that we can work on managing their thoughts, feelings and behaviours.
Patients can be referred to us by any professional in their cancer team. That can include anyone from the cancer support team or a wider medical professional, including their GP.
Following a referral to our service, patients are offered an initial assessment, which is an appointment with one of our clinicians to talk through their difficulties, any problems that they might be experiencing related to their cancer, and to set some goals that they might want to work on in therapy.
It might be that after that one-off assessment session, where some tips and advice are shared, that's all the person needs to be able to move forward.
If it's felt that more support would be beneficial, then patients would be offered regular therapy sessions, which can be either face-to-face or online, via video appointment, in a time that works for them. So we try and be flexible where we can.
It's completely understandable to feel a bit nervous. Lots of people haven't come to a psychology assessment or had therapy before, so it makes sense you're going to feel a bit apprehensive and a bit anxious about coming.
You walk through the doors here in psychology and you know that you're supported in whatever layer you might need. Your mental health is every bit as important as your physical health from when you get your diagnosis onwards, but also coming out the other side. 2 years on, I still find coming to psychology a great grounder in not only my space as a cancer patient, but also just as a human being. I thoroughly recommend asking for help in every avenue, and that does include psychology.
We get a lot of friends and family feedback about how valuable it is to have a confidential space to talk really open and honestly about how they're feeling and how they're coping.
For my family, it was very much gave me that outlet that then still allowed me to be a mum and still allowed me to have my business and still allowed me to be a family member and wholeheartedly, because I was able to have an outlet, which was fantastic.
I would very much encourage anyone that wants to come or is unsure about coming, just to come to the initial assessment, just to find out what can be offered to them, what support they might kind of benefit from, and then they can make an informed choice about whether they want to continue coming or whether it's right for them.
When you see somebody come in for the first time and they're feeling really distressed, and when you say goodbye to them at the end, even of the session or overall of all the sessions, when you say goodbye to them and you know you've made a difference and they feel better and they feel like they can manage, yeah, that's amazing.
I really enjoy working with people and helping them find their way through difficult times in their lives. I enjoy helping them understand kind of why they're feeling the way they're feeling, what's keeping them feeling the way they're feeling, and helping them move towards developing some strategies and tools that help them feel more in control of their difficulties and more able to cope with them. I find it really rewarding to be part of that journey with people, watching them kind of grow and develop in their awareness and also their skills, and I guess helping them get back to a life that they value and a better quality of life than they were kind of at the beginning of the sessions.